It's 1 p.m. and in respect to everyone's time, we'll move forward. I'm super nerding out about this because I've worked closely with both Dante and April. And so this is really special to me. And I'm going to try to keep my questions to the minimum to really share the space here for everyone else to ask. But my name's Annabelle Rodriguez. I'm an assistant professor in the Aegis department, which is the Epi Human Genetics and Environmental Sciences at UT Health School, Public Health in the San Antonio campus. I also lead the small rural healthcare systems as well as the food supply chain, and I'm also the outreach director for the Southwest Center for Occupational and Environmental Health. And like I said, I'm really excited to present this TEPHI talk. Next slide. And I'll have Janelle talk a little bit about what TEPHI is.
Hi, everybody, and thank you so much for joining us. I'm Janelle Rios. I'm the Deputy Director for the Texas Epidemic Public Health Institute, or affectionately known as TEPHI. And I'm so happy that you all have joined us today, especially our honored speakers here. TEPHI is structured in 3 different areas. We call those cores: readiness core, communications core, and a training and resources core. Our readiness core is a fun group of practitioners and scientists and people who are getting the word out to and training folks that are out in Texas. We have an early detection program, which is focused at the moment on wastewater and analyzing data from wastewater. It's been incredibly helpful for physicians in these different areas of Texas to prepare for what we're seeing in the wastewater and prepare for those pathogens out there. We have a vulnerable populations team, which is doing wonderful work, especially along the border and in rural health, food chain preparedness, business operations resiliency. And today we're working with the business operations resiliency team to bring this TEPHI talk to you. So moving on to the communications core, these are wonderful people who really know how to communicate to a variety of people. And we're so lucky to have a fantastic communications team. And they're the ones who are in charge of developing the slide sets, creating and the technical aspects of events like this and so many other events. They also have a group that works with media and graphics. And we have a training and resources core. We do a lot of training, both online and in person, in English and in Spanish, to a variety of audiences. Those include scientists and healthcare providers, of course, business operators, and I hope many of you are business operators, the lay public, community health workers. You know, we bring the training to folks and meet them where they are in the language that they prefer and in the medium that they prefer. And in talking about training, let's go on to the next slide, because I do want to highlight the certificate program. So this is a certificate. It's a non-academic certificate in pandemic preparedness and response. It is free and available to all Texans. And it's designed for volunteers. So if you are interested in infectious diseases and preparedness and surveillance mechanisms and epidemiology, please take a photo of this little QR code here at the bottom of the screen. It's going to direct you to a location on our website where we define 4 different courses. They're self-paced that you can take, at your leisure, followed by a live online capstone exercise, which is really fun. And we also provide a link to an electronic textbook. So again, this is all free and available to you guys. So I hope you take advantage of it and join us. So thank you again, everybody, especially again, Dante and April, and I turn it back to Annabelle.
Thank you so much, Janelle. Just a couple of webinar housekeeping rules here. You should be muted with your cameras turned off as soon as you come in. Again, out of respect for our speakers and their time, make sure that we have a nice and quiet environment. There will be some closed captioning available. Just make sure you look for it. It's down there by the tiny little world caption. Please ask questions by typing them in the chat box. We will be looking at them and really sorting them out to make sure that we have them organized by the time we get to the question section, we will have a satisfaction survey. We'll send out that out via email as well as through the exit of this webinar. And we are currently recording this webinar, and this will be available on our YouTube page in about a week. Next slide. All right, so to the main show, and to really a great honor of mine to be able to introduce both Dante and April. And I'll start with Dante first. He grew up around agriculture before graduating from CSU Monterey Bay in 2006, and immediately began working with C.H. Robinson's perishable transportation division. Soon after, he moved to McAllen, Texas, which is in the Rio Grande Valley. And in 2010, he changed roles and began working fresh produce sales and special projects, which would span really across several of the South Texas grower, shipper, importers, prior to assuming the position that he has now as president and CEO for the Texas International Produce Association, or as we call it, TEPHI, in 2017. Today, the association really represents nearly 400 member companies throughout the fresh produce supply chain. TEPHI educates, they advocate, they promote, and they represent more than 12 billion in fresh produce that is either grown in the state of Texas or considers Texas its first point of domestic arrival for the North American distribution. TEPHI is also the host and planning organization for the regional trade show, Viva Fresh Produce Expo, which I've been to, and it's absolutely amazing. And this brings about 2,500 fresh produce professionals together to network and really shine a light on the importance of the Tex-Mex fresh produce corridor. So again, Dante, thank you so much for being here. I want to move on by introducing Ms. April Flowers. She joined Lone Star Citrus Growers in 2014 and serves now as her marketing director and benefit administrator. During her tenure, she's created a marketing program for the company, which has included developing a brand, which is not easy at all. I know this, creating omni-channel marketing and launching a D2C program. Because of her unique positioning within the company, she directed the COVID safety and compliance measures through the course of the pandemic, and is proud to share that Lone Star Citrus Growers never had to close its doors due to an outbreak. Lone Star Citrus Growers is a grower, a packer, a marketer, a juicer, and a shipper of sweet, juicy oranges and world famous Texas red grapefruit. It's independently owned and operated, and they are absolutely committed to adding value to the citrus category by providing a reliable supply solution and unmatched customer service. And April, again, thank you so much for being here. And this little next slide that I had to just really add, if we can go to the next slide, is really on a personal note from myself and my team. I really want to thank Dante and April for their support, which really allowed our team to reach and vaccinate over 2,500 hard to reach agricultural workers and their families. In total, our team issued almost 6,000 vaccine referrals and education, with over 60 on-farm vaccine clinics and 5,000 door-to-door campaigns in 31 rural counties, 61 different zip codes, and working with 31 different community-based organizations. So from the bottom of my heart, thank you for believing in our team. Thank you for being the first ones to open your doors towards us and believing that we could make a difference. And without being said, I'm going to open it up, and I'm really excited. Thank you again for being here.
Well, Ms. Annabelle, thank you very much for that great introduction. We appreciate it. And on behalf of the industry, I do just want to say thank you very much, because what you guys did and what the team had done for the farm workers was huge, because traditionally that's an underserved community and they always have concern about accessing resources in the public space. And so bringing those resources direct to them on the farm was a huge connection and a huge value point, not just for our workers, but for our industry as well. Because as was mentioned in the introduction, we never shut down even for a single day. So with that said, we're going to kick this thing off, and I've gone ahead and shared my screen here as we begin the presentation. We're going to talk a little bit about Texas's fresh produce industry's response to the pandemic. Thankfully, Ms. Annabelle did a great introduction about TEPHI. We are a nonprofit organization that represents the entire fresh fruit and vegetable produce supply chain. She also did a great job introducing Lone Star Citrus Growers, who is a handler, marketer, seller, grower, shipper, packer, on and on of Texas grapefruit and oranges. So with that said, I'm going to do a real quick introduction to the size and scope of our industry, and then we're going to jump into the pandemic conversation. So these are the 2020 numbers.
We can't see the slides for some reason.
Uh-oh.
Yeah. Dante, sometimes that happens when you put it in presentation mode. So you can keep it off presentation mode.
How about this? Can everyone
This
see
is
this?
better. Yes, we can
Perfect.
see it now. Thank
All right.
you.
Apologies for that. Okay, let's try this again. So what you see on the screen are official numbers from USDA. So this is all official. Unofficially, we actually anticipate we have a little closer to about 230,000 acres in production, a little less than 7,000 fruit and vegetable farms in Texas. We're one of the few states that grows fruits and vegetables in the winter. So that means that from October to May, we really have a bulk of the country's fresh produce being grown in the state. And we're growing 60 different crops, the largest being watermelons, the second largest being grapefruit. What also makes Texas important is the vital role that the Mexican imported fruits and vegetables play to our industry. Overall, the U.S. imports about $16 billion worth of fruits and vegetables. More than half of it comes through Texas. The other half crosses through California, Arizona, and New Mexico combined. So if you live in the state of Texas, the statistic is that 2/3 of the fruits and vegetables you eat came from out of the state. And overall, more than 50% of the fruit we eat in this country is imported. So that gives you an idea to just how important Mexico and imported fruits and vegetables are and what they do along with Texas. So with that said, let's start talking about the least favorite thing that everyone has on their minds, and that is the pandemic. So we're going to go over the timeline just real quickly. And this timeline, I picked points that were specific to the fresh produce industry, because I think all of us really kind of know what the pandemic timeline was in our own spaces or worlds. But anyway, March 2020, the pandemic arrives to the US. That could not have been at a worse time because literally every crop we had in Texas was in the ground. Watermelons are already planted. Onions have started production. Grapefruit and oranges are still up and running. Our leafy greens are still in the field. Why does this matter? Well, on March 17th, everybody who's a non-essential goes home. Fresh produce never went home though, right? We might have stopped for 2 or 3 hours in the afternoon when we weren't quite sure what to do, but we had to bring everyone back the next day. In the industry, we have a saying, you sell it or you smell it. I don't think there's any more graphic representation than the fact that fresh produce does not wait around just because something else is happening. We've got to move it, and every day we don't, it loses its value. April, you want to talk about what happened on March 25th and what it did to our industry?
So March 25th, we started to see grocery stores beginning to cancel orders. Restaurants were closing down. So of course they were canceling their orders. And this caused major disruption in our supply chain. So our business really doesn't do very much food service. We really follow the retail pipeline, but there are plenty of businesses that do a lot of business through the food service pipeline. They were shut down completely. Their fruits and vegetables still had to go somewhere. So they were trying to divert into retail, hopefully. Meanwhile, retailers were starting to realize we have to have toilet paper, we have to have, chicken, we've got to have potatoes, so like very staple items, bottles of water, and they began canceling their orders for anything that was not like in the top 10 basics, because there were only so many trucks to go around. There was only so much floor space. So those of us dealing in fresh produce were in a really tight situation at that point, because the food has to go somewhere or it spoils, as Dante said. We were close enough to the end of our season that we had to make the difficult decision to go ahead and end the season, because we would have been then operating at significant losses. And so we had to send all of our delicious fruit to juice, which is just a salvage operation for us, but we just couldn't get it to the end consumer.
So unfortunately, there were a number of commodities that did not have an outlet. And we saw a lot of farmers just get out there on a tractor and plow their fields into the ground. Of those 60 commodities we grow in Texas, about 20 of them are intended specifically for the restaurant supply chain. And so with those restaurants closed, basically shuttered down, if you recall, the restaurants didn't really open again until, I want to say, late May. So there was 2 months there. And again, produce doesn't hold like that. So we saw a lot of loss. Anyway, moving on, June of 2020, we start to see a brand new problem happen as a result of supply chain disruptions, limited access to farm equipment and factory supplies. April, you want to tackle this one too? I mean, you lived through that one brutally.
So, I think it's often taken for granted that we're seasonal businesses, and there are really two seasons. There's the revenue harvest season, but the rest of the year, we are in a growing season when you're dealing with trees, and those trees have to be pruned, and you have to, practice pest management. There's a lot that goes into our growing season, and we needed tractor supplies. And we really struggled to get those basics in order to just keep our farms operating in a way that would allow us to have a decent crop in the following harvest season. So we were at a point where I was telling all of my fieldmen, if you think you're going to need it, put an order in. We will buy it and use it later if we have to, but we're so concerned about not being able to operate our equipment. That was a very touch and go time period for us, certainly.
Yeah, we actually saw a number of farmers, what they would do is they'd get together and they'd go buy an older used tractor. And then together they would kind of scrap out the parts from that tractor. Because the parts, as April said, we started putting orders in for parts, but because everything was shut down, all those orders, that backlog immediately went from a month, 6 months, 2 years. And so folks are just now starting to get parts that they might have ran out of or ordered kind of in those late days of the pandemic. So moving on, December of 2020, vaccination begins. Again, if you're following along, our season is October through June. So we got kicked in the rear the last half of our 2020 season. And now we have already started our next season in October, and vaccinations are just now beginning in late December. And if you recall correctly, there was a long wait list, and a lot of folks, even if you signed up in December, did not see access to vaccinations until late February, early March. So again, we still had to run conclusion of one season and about 6 to 8 months of the next season under pandemic rules. And then in March of 2021, Texas goes mask free. This addressed a number of situations, specifically the warehouse and worker situation, folks being on the line. But again, a critical milestone in what was a number of issues and challenges that we had to work through. Okay, so what were the specific challenges that we saw in Texas? You know what, April, I'll let you talk about this because you got to live front lines on a lot of this.
Oh man, yeah, we really struggled to get just the very most basic thing. My secretary, my CFO, we were all just scouring the shelves looking for simple things like hand sanitizer, toilet paper. At one point, we were having to check out toilet paper to our employees because if we left it in the bathrooms, they didn't have any at home and they were taking it home with them. And the one thing you absolutely want is your food service providers to be using toilet paper and washing their hands afterwards. We cannot operate without those very basic items. And we multiple times were down to like a day or two of supplies left before we got it. And it seems like we would have access to this through other routes, but no, even our commercial suppliers were very low on supplies. And I promise I'm doing what I can to get it to you, but we never had an actual timeline with us that assured us that we would have what we needed. So we were very much living day to day as far as whether we could operate. Beyond that, I think what was probably the absolutely most difficult challenge was insufficient access to testing. And this was huge for our operation. So to give you an idea, we have about 40 to 50 employees who work year round. And then we have 200 employees at the peak of our season. So every time one of our essential workers had a sniffle, they started to develop symptoms, they were exposed, they had to go get in line behind every Tom, Dick, and Harry who also had a sniffle, and even if they were staying at home, regardless of their risk level. So this meant, and actually let me back up a second, a lot of our laborers are not insured. They don't have $100 to go buy a rapid test. They didn't have access to a lot of the traditional revenues for testing. So they were having to go get in line at the free clinic. And I can tell you at one point, the appointments were 5 days out. So we were losing employees, day one sniffles, 5 days before they could even get tested, and then an additional 3 days after that. So now we're out 8 days. And then if there was additional quarantine time necessary, we were losing employees for a long time. Now, obviously, if they were positive, they were going to be out anyway. But if they were negative, once they got tested, they couldn't come, we couldn't allow them to come back on property without a negative test and being symptom free. So we really struggled to get these tests to our employees. And I think that this really should be a very large lesson learned moving forward when the next significant event happens. In order to keep our basic systems running, the people who are making those things happen need to have reasonable timeline access to those tests.
Absolutely.
Don, I'll let you kick in now.
Yeah. So, a lot of that, I'm sure you guys heard from other industries. But April's right. As producers of the food supply, we often found ourselves challenged or having to tell our story of why we qualified as essential workers. And that plays into the next point, law enforcement. Believe it or not, law enforcement was a huge problem for our folks March and April, right as the pandemic struck. Basically, the police were operating under the assumption that nobody should be driving. And they were stopping our field workers. They were stopping our warehouse workers. Again, these are folks who have concerns about accessing any government-facing resources as it is. And now they're being stopped by the police. So April was talking about the impacts to the workforce. Imagine that right there. I can't tell you how many police departments locally I had to have conversations with the chiefs and tell them specifically how the essential worker guidance worked and that these folks were essential and were permitted to do so. I mean, I had one situation where a police officer threatened a warehouse worker and said, if I see you on the road again, I'm going to take you directly to jail. And so it was a bad scenario. Thankfully, the Texas Department of Agriculture stepped in right away. The commissioner helped get us some letters that had their official TDA letterhead and had a help guideline number at the TDA where the police officers could call in case they thought the letter was fake or nonsensical. So we were able to address that. But then we had another issue. So the season starts again, October, November of 20. All of a sudden, I start getting calls from warehouses and field workers that the fire department, Department of Health, and our local health departments, as well as OSHA, are just doing pop-in visits, right? Just saying, oh, we got a random call that there was a bunch of cars here. What are you guys doing? And so I told all my folks, listen, don't be hostile, don't be aggressive. You have the law enforcement call me, or you get me on the phone and I'll talk to them directly. But, I remember very clearly talking to a local fire department inspector who was doing a warehouse check. And I asked him point blank, I said, just out of curiosity, what are you looking for? And he tells me, well, I'm looking to make sure health is not compromised. I said, okay, tell me about that. What does that mean? And he said, oh, well, I'm just looking to make sure the conditions are good. I was like, okay, I'm going to stop you right there. Don't take another foot in that warehouse. You need to tell me specifically what you're looking for. And that resulted in a bigger conversation, but that needed to happen. Again, law enforcement got this much of the information and then started acting. And so that was a big problem for us and our industry.
I will add into that, this was a big failure because this was an opportunity to create partnerships. And instead, what it did was create an adversarial relationship what is OSHA going to do when they come in? What are they looking for? I don't know. I'm doing everything I can, but I have no roadmap. And that put a lot of pressure on those of us who are trying to run these safety teams. And it really made it difficult to make good decisions, to take a step back and be confident in what you were doing. So again, I think this is another lesson learned.
Absolutely. So we had a few more protections or a few more issues, and I think that this next one definitely leads into it. April, you want to talk about this one, the lack of legal protections?
Yes, I will tell you that I spent hours and hours on webinars with workforce attorneys, really trying to give us guidance in what we needed to do in terms of premise liability, how we could protect ourselves, our businesses, and our employees. And all we had to do was look at very early on the case at the Tyson factory. Basically, the family of a decedent was allowed to bring forth a litigation against Tyson because their family member had contracted COVID and died. And they said, well, it happened at your factory. And we know now in hindsight, everybody was being exposed every day, several times. And there's no way to prove that that was, that she contracted on site, or did she do something in her personal life that caused that? So it was very nerve-wracking because we're juggling flames and now we got to throw a knife in here with it, right? And so we had no legal protection. And it really came down to, again, the pressure, the burden of the pressure. You better do things right or you're going to be in big trouble, but we're not going to tell you what right is. We're not going to tell you how it should be done. Just know you better go to work and do this every day. And do it right, but we can't tell you how. And so it was very difficult.
Yep, that's right. And so April and I, like I was telling the group earlier, we have a lot of info and we really tried to condense it down to fit specifically to this talk, but not to go too deep into this. One of the challenges that we saw as the industry was a lot of the guidance coming from federal, state, and even local authorities was designed specifically for employees. There was very, very little guidance provided for employers. And so just like April said, a lot of folks had to get on those phones with lawyers and try to figure out what the best strategy was to hold a safe workplace, to still be able to produce that product, but to honor the obligations that you have as an employer to maintain a health and secure environment for your workers. So finally, was the lack of childcare. Most of our workers in the industry have a scenario where both of the parents are working, right? The mother and the father. During COVID, there was no childcare, right? Or very limited options. And so we basically saw our workforce cut in half. Many people probably had significantly less numbers, but easily it was cut in half just overnight because of that. So that was a very, very big challenge for us because we're already an industry that suffers to get enough people. So moving on into the solutions or kind of our recommendations, so to speak. Communication. I'm going to sum that up real quick. There cannot be enough good communication, and we'll talk about that on the next slide, but quality communication is huge. And so essential worker travel permissions, that scenario that I identified with the police stopping people, that's a huge one. Obviously, that occurred as a result of situations that had happened in the days following the shutdown. But, moving forward, that would absolutely be something we recommend. Having that document in place, having guidelines for who receives that document, and most importantly, for law enforcement knowing how to look for that document and or that they should be looking for that document. Next, worker health communications. This was one that was real big, not so much at the front end of the pandemic, but more in 2021. There wasn't super clear guidance on when workers were supposed to stay home, how long they were supposed to stay home, what a quarantine looked like, what the exposure rates were. And that was information, frankly, that was changing every month. Now, we know a portion of that is because this was a pandemic or an endemic, whatever word we want to use here, where we learned information over time about it. And so obviously guidance was going to change. But from the position of an employer, if you are providing communication and guidance to your worker, and that worker is out for a week or 2 weeks, and then they come back and the guidance has changed, but that one worker for some reason didn't get the new guidance, you understand how immediately in a workplace scenario like April outlined, where you have 300 people, one person in an exposure event can be the catalyst.
Absolutely. I will say the most effective thing that I think we did was with every single paycheck, every single week, we included a bite-sized piece of information for all of our employees, and we provided it in English and in Spanish. And it was really, for us, I was having to go to the CDC website, OSHA's website, the DOL, take all that information and figure out how that actually applied to our employees. And so by giving them bite-sized pieces of information, just everything, here's where you can go get tested. Here's how you can quarantine in your home, because you have to remember a lot of our employees are in multi-generational homes, and many of them are in multi-family homes as well. And so really just giving them bite-sized pieces of information to help them wrap their heads around how to respond in certain situations. I had a great chart that was helped them assess their risk level for a certain number of activities. So I think I had 20 activities, and it really, helped them understand, well, I can go to the park and that's safer than going to a concert or the shopping mall, right? And so these things were actually, I think, probably the most helpful thing that we were able to do for our employees outside of testing and vaccinating.
So some of the other solutions our industry adopted were adaptive or unique solutions. For example, we had a number of people that implemented shower curtains on the lines. Why is that important? Well, anyone that's ever been in a manufacturing facility knows that it's built out of metal and it costs millions of dollars. So just because the pandemic struck doesn't mean we can expand the processing line another 30 feet so we can space people out. The space we have is the space we had to work with. So we slowed down the run lines. We added shower curtains. We had secondary inspection points so we could space people out. We introduced ventilation and air circulation, right? We had people were cutting windows or air vents at the top of the warehouses, and they were installing fans or vacuuming air out of the internal portion of the warehouse and out, just so that way they could increase the circulation of the air. They were adding filters. That was another big one where we had little unclear guidance, were their filters better than others or not? And anyway, that's probably a conversation in and of itself. But really the biggest solution that almost everybody to a T implemented were control points. You had the exit and entry worksite protocols, right? There were people taking temperatures. You had mandatory sanitation stations. You had folks sanitizing the shoes. I know of at least 3 warehouses where every 15-minute break, they had a sanitation crew coming through, sanitizing all the touch points that the workers might have even rubbed up against. So another solution that we saw was people limited sections of the warehouse to small groups. So for example, you have receiving. That was a group, and that group was not allowed to communicate or walk over or engage with the other groups. It all had to be electronic. You'd have your actual packers. They would be a group. You'd have shipping. That would be a group. You would have warehouse and foreman leadership. That would be a group. And the point of these groups or different shifts or the downsizing and the spacing was obviously to reduce outbreak opportunities or outbreak possibilities, right? Because if you already have a labor shortage and now you have 4 guys working in the shipping office and one guy happens to get sick and all 4 of your shipping guys have to be home for at least 2 weeks, what are you going to do? Again, produce can't just wait around. You've got to have people available. So that's why we saw ourselves fragmenting our workforce further, was to create those separations while maintaining the skill sets that we needed at the facility, no matter what happened. And then the other,
I'm sorry. One thing that I did with my team that I would recommend to anybody, we have several different positions and roles within these warehouses. And I took my team and I said, okay, I'm a packer. Where am I going first, second, third, fourth? Walk me through their routine. Okay, now I'm a forklift driver. Walk me through their routine. And we analyzed every single position to find out where the touch points were, where there were possibilities for too much mingling, and how try to determine how we could really separate things out. And eventually we got down to rotating and separating out whenever we could, which was not often, but it was helpful where we could. We would try to separate production days. This is when the fruit comes through, it gets cleaned, it gets processed and sorted. And then pack days, where it actually is then packed into the bags and boxes. And whenever we could, we would try to drop a day that was admin only. And that would give our employees, okay, well, here's the 24-hour period. If somebody's going to develop symptoms, that can at least keep them out. That gives them 24 hours to develop and, keep them from re-entering the warehouse. And that was helpful, but difficult to do, certainly.
Absolutely. So last but not least were the vaccination clinics. And again, this was huge. Annabelle and her team were fantastic, because this is really where I feel like we started to see a turnaround. Once we started to have vaccinations, it felt like we were past a lot of the troublesome issues, or the most burdensome ones, right? Because we were finally in a position where it was like, okay, we have now removed a lot of the lethality of the virus, right? We now know we're dealing with something more akin to the flu or the cold as a result of the vaccination being accessible to more of our workforce. And kind of a happy unintended blessing there was that at the same time they were doing the vaccination for COVID, Annabelle and her team came across some opportunities, and we ended up getting access for a lot of other medical services and other vaccinations available for the farm workers. Again, this is a vulnerable community that doesn't often step in where you have public resources available if it's a government-facing entity. Even though many of these folks are registered to work, they just have that apprehension or concern. April, you want to talk a little bit about it? You actually participated and put your employees through a clinic.
Yes, what I really appreciated about these vaccine clinics were that they allowed us to vaccinate the entire family. And this is really important, because beyond the trust issues and beyond the financial barriers, a lot of our families are living in what I call pharmacy deserts. There is not a pharmacy anywhere near their homes. And they are so busy with the day-to-day of, taking care of the kids and getting to work. That is a trip that it can be very far out of their way to go get vaccinated. And so it was wonderful. We were able to knock out COVID and flu, and I think we did some pneumonia, and I think we're looking at doing tetanus this year. And these were opportunities that a lot of our families just didn't have. And so we saw a lot of elderly parents coming in. And this made me very, very happy, because we were able to protect the bubble. If you get the vaccine, but you're surrounded by people who haven't had it and they still get sick, of course, we all know you're still exposed and you can still get sick. So I really appreciated the opportunity to vaccinate the entire bubble.
So I know we're running up on time, so I'll go through these last two quickly. Most of them play into what we saw as solutions that the industry developed over this period. First and foremost, essential worker focus, right? Making sure that we are notifying and talking to the worker population often, early, and frequently. They got to know quarantine measures. We really need to get the best practices for that multi-generational, multi-family household like April was talking about. What do you do when you have 3 generations, or sometimes even down here in South Texas, 4 generations of the family living in the same house, with them all going to different work sites? What do you do in that scenario? Government guidance really needs to be simple. Early on, we saw documents that were 20, 25 pages long, very technical. We did our best to break down that information and get it out to our membership. But again, remember that scenario we talked about where guidance changed frequently? Man, that was a huge, huge issue, because we'd have people who, all it takes is you miss one email and you're not up with the most current guidance. And so that's where we really got to reinforce, when guidance comes out, do as much as possible to make sure that is viable guidance that is in place for as long as possible. The more changes, the more likely we're going to have someone miss it. Safety team models. This is a great idea. April, you want to chat about this one real quick?
Yeah, so I feel like we were really successful because I had 15 people on a safety team and they represented all areas of our business. But we were truly just lucky. I was in this unique position of being the benefit administrator, and I was connected early on to some really great resources. But I got a lot of calls several months into the pandemic from other facilities all over the nation saying, we thought this was a joke and now it's in our backyard. What do we do? Like, they truly didn't even know where to begin. Whereas I had 3 months to train and get my people in place. You know, it would be really, really great for businesses to get here's a basic, have every aspect of your business represented. These are the things that you need to consider. Here are some basic guidelines and steps to really assess the potential disasters in such a situation and how we can now address them now that we know what they are.
So, April talked about the timeline that it took when our folks did not have access to testing. So making sure that we're setting aside a certain amount of rapid test or vaccines for essential workers is huge. And I'll give you a direct value statement on that. The more impacts we have to labor, the longer it takes us to do something. The longer it takes us to do something, the more expensive it becomes. That's where you get your food shortages. That's where you get your increased food costs. So that's one where you see a direct ROI. And then finally, these last two, communication, we talked about that, making sure that the public and private sectors are part of the same conversation. Like I said, law enforcement got this much information and that's what they ran with when they really needed this much information. We really need multiple outlets for like information. It felt like you had to go to one agency to get a certain portion of the regulation. You had to go to OSHA for the worker safety. You had to go to the Department of Health for the testing protocols. We had to go to Department of Ag for our essential worker guidance. It really would have been great. The more places we could amalgamate that information and offer it out at once, the better. TEPHI tried to do that for fresh produce, but frankly, that would be great, I think, across really any level.
I would just add into that, this really opened up a lot of room for interpretation. And when you're talking about a pandemic, that's dangerous. We really did need streamlined information. This is what everybody in this industry should be doing and how they should be doing it.
Right. And this is another one, educate before you regulate, or education before regulation, right? The police officer going out there and telling people he's going to throw them in jail if he sees them driving around again. Come on, that's definitely not what we need anywhere. And then last but not least, reserving necessary supplies for food production, right? April talked about that situation with the toilet paper. Again, toilet paper was pretty much going just to grocery stores. Commercial supplies almost never had any of that. Masks, gloves, hand sanitizers. Again, a lot of that was going direct to grocery stores. So the more we can do to make sure that there's a certain amount of that set aside for essential services like food production would be huge. So April, before I open it up for Q&A, did we not touch on anything, or we got it?
I think we got as much as we could into that time.
Well, y'all did an amazing job. Y'all are definitely my people, because I was just like, yes, every time you brought up a point. We've got about 15 minutes here, so I want to make sure that we answer some of the questions that we have here on our Q&A. One of the questions that we had during the presentation was, in the food industry, there is an intense focus on hygiene. Could you briefly describe the enhanced features put in place with a pandemic? And this person asks because they're thinking it would be valuable to be knowledgeable to anticipate when a next event occurs.
Sure. So one of the things that we did at Lone Star was we provided hand sanitizers. I talked about how we walked through every position and how every person was moving through the shed physically. So we provided several hand sanitizer stations. All of our supervisors, we have big wash sinks that have to be used every time you enter and exit the floor. And so Sometimes it's as simple as supervisors, you need to sit there and they have to physically wash their hands until you finish saying the ABCs so that we know it's been 20 seconds, or however long. So we did that. We added in additional sinks so that they could spread out while washing their hands. Really a lot of the controls were administrative. So now everybody's going to funnel through this door. And we're going to break shifts out into time, so that not everybody's coming in at the same time. We're going to take lunch shifts at a different time. Not everybody's going at lunch right now. We provided outdoor seating during lunch. On every mirror in every bathroom, I had a song, the lyrics taped up. Sing this song in your head while you wash your hands. And that was helpful. People were doing it, and so really just a heavy focus on more hand washing and separating out as much as possible.
Something else too, or two things really, is one of the things as well. Our industry has a massive focus on hygiene already as it is. You do food safety classes, you do worker training courses just for day-to-day operations. When the pandemic came in, it was basically like we gave that thing a steroid shot, 15, oh my gosh, freaking monster drinks, and then just got going. So what happened is we do a daily clean every day, and then you'd have an intensive clean at the end of the week normally. What happened is we started doing intensive cleans of the entire facility every night. We were doing cleanings in the middle of shifts. Some people went as far as doing it during breaks. April talked about the sinks. I heard about people programming warehouse sinks to run the water for a certain amount of time. And the objective was that you washed your hand until the water turned off, right? People put footsteps in to activate the sink. They put those little foot guards to pull the door open and closed. A lot of electronic monitors were put in so that way you could automatically have a door open and close without any physical contact necessary. So there was a lot of different pieces that went into play. And I think a lot of it just depended on the resources you had access to, how quickly you could get those resources, and what your facility setup was. Because if you're packing outside, like watermelons, a lot of those come from the field, they get a wipe and then they go straight into a bin and then onto the truck. You don't need as much as like a grapefruit facility where you have a lot of people in a small enclosed area.
I will say I never in my life thought that I would ask for an electrostatic sprayer for Christmas, but I did, and we did get one. And so that was one of the major upgrades. So every part of our facility was sprayed every single night. And then we had a specific protocol if somebody developed symptoms while at work, or if one of our administration employees called in and said, "Oh, I'm sick now," we would spray the room, close the door. We had to have people specifically trained to use it. But it was definitely helpful in beating back the germs, but I think psychologically very reassuring, because our sheds are so full of touch points and there is so much machinery, and you can't sanitize it all by hand. And so I think that was very helpful.
I will say, I just saw, Dante, one of those sinks that does the 20 seconds, and it's remarkable because you're like, okay, yeah, I could have gone a little bit longer. Now I know, right? Even though we've been doing this for 3 years.
Mm-hmm. Yep.
I have a question for April here specifically. Did you have the safety team concept in place already from other threats prior to COVID? And going forward, are you planning on tabletop exercises to keep those safety teams trained for future threats or outbreaks?
That's a great question. No, we did not. Now, I will tell you, every shed has a small little safety team, in that we have a safety officer who's certified and make sure that, they oversee the audits, they make sure that we are in compliance. But that is a more than full-time job, because we undergo several annual audits. And so our safety officer, there's no way that he could have done this on his own. It would have been physically impossible. So we did build this airplane very much while flying it. And we had everybody from the security guard at the front gate to human resources to my head field man. You know, we really represented every single aspect of our business in this. And I would say the reason this was so helpful was everybody was on the same page. And there were several people that any employee could go to ask, what do I do in this situation? So all the information was flowing up to one point and back out to everybody. And I will even say that so we're a family owned business, and all of my in-laws got sick, and then my daughter got sick all at the same time, right over the holiday. And so we were all quarantined at home because my husband and I were waiting. I was quarantining with my daughter and he was waiting on results, and my in-laws were sick. And there was a period of 4 or 5 days. Well, no, it would have been like 7 days. Not a single owner was on property for the first time in our company's history. That had never, ever, ever happened. And you know what? We had 0 problems, because our team was well-trained. They knew exactly what to do. We called in, we talked every single day. And so it was just something that we built on our own. Tabletop exercises, that's actually a really great idea that I am writing down. And I do think that we will actually consider or do these things. So we are going to continue with our clinics. When we bring our employees back for orientation, we're going to make sure everybody has access to all the vaccines we can give them and whatever they want. And I think that's a great idea. I think that's a very smart idea.
And you know who to call, April.
Oh, girl, you're on my list. And I will say, to a certain degree, I do still get questions. We are still dealing with this. We do still have, on occasion, people who are very close exposure or do get sick. And, so we're still utilizing this model, even though we've let go of weekly meetings and, phone calls.
April, you said something about that was really remarkable, which is, you were out for a week, you had 0 issues because you had done all this training. And Dante, you mentioned, job rotation and cross training. What did this do for your workforce and for people who otherwise wouldn't have had an opportunity to train in those positions for your productivity? How did it change that? Or, how was it positive, or how did it not work?
On my team, I will tell you that it really fostered such a sense of, we were teammates, we're all working towards the same goal. We became very close, and it just really created a lovely work environment. It's one of the weird good things that came out of this, because we were all cross training. We all had to be ready to jump and do strange things we'd never done, right? And think on our feet and come up with wild solutions. But it really did make my team much stronger in the end. And, we work really well together as a result, I think.
Yeah. And Annabelle, our industry is very flat, right? It's not like a corporation where you have lots of levels of management and divisions. I mean, April works for a family company. Her mother-in-law runs the books. Her brother-in-law is the field foreman. Her husband is the sales manager, or what is TJ's official position? It's not sales manager.
Vice President of Operations and Sales.
There we go. Vice President of Operations and Sales. So, I mean, we have very close-knit communities as it is, but we don't always have that at that worker level. And I think what the pandemic did is it created, like April was saying, a communication network within companies that previously didn't exist, and I think still exists today as a result. And that's huge, because while those networks were developed specifically to address the pandemic, moving out of it, I've already seen a lot of folks have better relationships throughout their entity or organization because of that network, right? So for example, we're working on a project with lime grades. And previously, where a salesman in one part of the company would not have engaged with quality control in the other part, those guys are now at regular communication points, and it's as a result of the pandemic. And it's as a result, like April said, they had to engage with each other because someone would be out, or they had to cross train on skills, or just frankly, you needed to know what was happening down there in a way that you previously didn't need to know about it because the pandemic drove that need.
It's such a huge increase in respect for one another's positions, you know, really learning about what other people are doing. I am a part of a women's organization. I tell these young women, look up as much as you can and learn as much as you can, because I learned a shocking amount about my own family's business when this happened, because I really had to learn every single position and understand the challenges. So it was very helpful in that regard.
So these are almost like the new normals that stuck around, right? Like Zoom. None of us did all of this, right? We would have had to travel to the Valley or you to Houston. And so we are all connected, and we have, almost 100 people online that are able to connect from different places that otherwise, we wouldn't have. So one of the questions here before we close up, and I have this little closer question is, Dr., you brought up, these multiple outlets needing almost to centralize information, right? Like you had information coming from OSHA and from the health department and from TDA. From what agency do you imagine these being centralized from? Because this could be a point of conversation. This could be a starting point of, we need to guide much better and do a better job next time.
In my opinion, it should be your entire state. So TDA should have the same information that Department of Health is putting out, that UT Health is putting out, that whoever else is putting out. And likewise, Department of Health should have the info that TDA is putting out, as well as the other entities. And the reason why, Annabelle, is so that way, no matter where you go, you see the same slate of information. Again, nothing is worse than you miss that one email and all of a sudden you're totally out of compliance, because you might have done 51 things right, but because you missed number 52, you're out. You have failed to comply. So I honestly believe that if you are a government agency at any level, federal, state, or local, you should hold all of those resources at your level there.
Hey, this is Bob. I'm sorry, I don't mean to jump in, but what you're bringing up is exactly what happened after 9/11 with regard to something called the Fusion Center. And that was all the law enforcement and public health response groups brought together so that the pointer finger knew what the index finger is doing. And so I'm wondering if what you're saying here is in the same way, the need for a fusion center for public health.
I think it needs to come from, the state of Texas, whether it's Department of Health or a fusion center like you're talking about. And the CDC, to an extent, did this on their site. If you are this person, here's what you need. If you're this person, here's what you need. But it really needs to be broken down by industry, because doctors and nurses had one set of rules.
Yes.
Essential workers like, food service, we had a totally different set of rules.
Mhm.
And so it really does need to be a very clear, where's your industry? These are your rules.
Mhm. No, that's a very helpful insight. Yeah.
Okay, and to close it up, we got about 2 minutes. I want to end it on a positive note, again, with much gratitude. But what was one heartfelt story that you have about how the industry leaned on each other, how your workers leaned, on each other to get through the pandemic?
So I can say that as industry leader, what I saw often was that our industry is a bunch of friendly competitors, so to speak, right? We'll come together when it's important. During the pandemic, and not just in 2020, I'm talking about all the way until even today, we continued to have a shortage of certain items, right? April talked about farm equipment. If you can't run a spray rig, you're out, right? How do you keep down bugs? How do you keep down fungus? How do you keep down XYZ disease? you got to have that spray rig. And so what we saw was that the community of ag industries came together, and someone would say, hey, I'm out of pallets. And you'd have 3 or 4 guys say, you know what, I can give you 20, or here's 100, or here's whatever. And so you had people who previously did not engage directly. And all of a sudden we kind of had this Facebook style community within the fresh produce industry that emerged organically as a result of just people saying, you know what, I want to help my neighbor.
I would absolutely agree with that. I just really think you saw so much humanity that, you know, whether it was at your business level or in the larger industry level, so many people, like all of a sudden it was all of us against the world, right? And it really and that's what it felt like very much. And so it really did create just a very nice community. And I agree, it continues to this day, certainly.
That's beautiful. I think that's a great way to end this. Dante, April, we really from UT Health, Houston, and TEPHI, just from the bottom of our hearts, want to thank you for your time, your support, your ongoing support with, you know, initiatives that we have. So again, thank you from all of us at UT Health and TEPHI. For everyone else, please make sure that you complete the evaluation survey that you will be emailed. The recording will be available in about a week, so make sure you are on the look for that. And please consider our certificate in pandemic preparedness and response. So thank you, everyone. Make sure you find us on our social media platforms. Thank you, Dante. Thank you, April. We'll see you.
Thank you all. Appreciate it.